It's a very complex question. I'll start with the one beautiful bill signed into law on July 4th this year is the result of a long history of challenges and missteps in U.S. healthcare management. Numerous attempts over the years have taken place to try to reform healthcare, but these have all been piecemealed and I would say met with heavy resistance from powerful interest groups that would include your insurers, your pharmaceutical companies, and providers. Additionally, many policies have been driven by short-term political gain rather than looking at long-term strategic planning, thus leading to unsustainable programs and unintended consequences. The other thing I think we really need to look at, in essence, this bill is not a singular solution, but it's rather a reflection of the unresolved issues and flawed approaches that have characterized U.S. healthcare for more than decades. The beautiful bill represents a significant overhaul in U.S. healthcare, the most extensive since the Affordable Care Act in 2010. It will affect Medicaid, Medicare, health insurers, and numerous federal healthcare programs. Key challenges and impacts are something we need to look at. The legislation introduces a comprehensive adjustment to Medicaid eligibility and payment structures. This will affect access to care, especially for those in very vulnerable populations. States and providers will need to up their game to adopt to new compliance obligations. This will require system upgrades and increased administration oversight. The bill includes changes in cost sharing requirements for Medicaid expansion, enrollees, and what we need to look at here is this could affect rural health clinics and their ability to provide care. This could lead to emergency departments at hospitals actually seeing more patients. We also are going to have significant funding allocations that are designed to aid verifying Medicare enrollees and addressing duplicate enrollments. This is something that's needed to take place for years. States must verify addresses of enrollees and regular check for deceased individuals, with implications for payment structures to ensure accountability. There's also supposedly going to be a system for real-time verification, which would be much needed. That's expected to be taking place by 2029. That once again will require significant oversight. Other things that are of importance here is eligibility for Medicaid and Medicare will be restricted to specific immigrant groups. Undocumented immigrants will no longer qualify for non-emergency services. Once again, could lead to more emergency department visits, and quarterly verification process for deceased enrollees and provider status check-ins will be mandated. We're going to see something else that's very interesting here, and that is limited retroactive coverage. The bill limits retroactive Medicaid coverage for certain enrollees, potentially impacting individuals seeking care in urgent situations. Also, starting in 2027, expect certain adults must engage in community activities to retain Medicaid, potentially jobs. There will be some flexibility for those facing hardships. We'll see how that goes. Also, the states will need to ensure proper outreach for fair notification process for individuals impacted by these changes. Using history as a reference, I'm not expecting this to go smoothly. Generally, there are issues with states communicating with the general public. Also, we need to look at considerable federal funding. This is going to need about a $200 million investment by 2026. The allocations to support states adopting these new requirements and improving new efficiencies will be a monumental task. Also, states will need to manage more complex eligibility requirements and fiscal responsibilities, and they're expected to work within a balanced budget type environment. We need to also consider that this bill reduces reimbursement rates for certain Medicaid services, potentially impacting healthcare providers' financial stability. One other item to think about there too is expect PACE programs in healthcare systems with memberships that have a large immigrant population, especially around Southern California, to fill the negative impact of revenue. ACA will also fill its impacts of this. The bill sunsetting of an enhanced Affordable Care Act subsidies. In 2026, we'll start seeing many of those come to an end. This could lead to increased premium cost and increased enrollment, potentially prompting calls for more comprehensive federal intervention to ensure coverage. The new funding mechanisms and restrictions will likely affect low-income and underserved populations, potentially leading to an increase in uninsured individuals if states cannot act adequately and quickly. We also need to consider a few more things coming up here. Many of these reforms won't take place until after the 2026 election. So the real impact on states being prepared and their ability to implement, that remains to be unseen. We just cannot guess what that'll look like at this point. Additionally, stakeholders must remain vigilant and monitor changes to ensure proactive compliance and address challenges in delivering care to vulnerable communities. Overall, I'm going to just come off with one item that I think we need to consider, and that is the increase in government interaction stems from various provisions that either expand government-funded programs or introduce new regulations and reporting requirements. While this bill wasn't directly here to create a single-payer system, its impact on healthcare spending, insurance coverage, and provider reimbursement could pave the way for a single-payer legislation in the near future. I know that wasn't a consequence or an intended consequence of this bill, and there's many things still to flesh out over the next few months, probably the next few years as this continues to take place.